Sponsored by the This event is co-sponsored by the Health by Housing Lab and the Health and Housing Consortium. Hi, my name is Evelyn Graham-Yasi, and I am a member of the Health by Housing Lab, Speakers Bureau, and Peer Network, and part of the Flipping the Script planning team. I am also a mental health and homelessness advocate. The intersection of health and youth homelessness is important. First of all, everyone deserves to be treated like a human being. Young people experiencing homelessness face unique challenges when seeking medical and mental health care because they are solely focused on survival and they may not know where to find any already limited youth-friendly services. They are also experiencing structural inequities and intersection of trauma, poverty, and youth development. For example, encountering insurance gaps and service restrictions due to a lack of parental involvement, or they are denied appropriate documentation that remains with a guardian. The goal of this event is to educate the audience on how to provide better care for young people experiencing homelessness. Having said that, I would like to note that today's event will discuss sensitive and graphic topics, including but not limited to trauma, violence, and mental health struggles. Next slide, please. We do have some housekeeping rules. The housekeeping rules are, because this is a webinar, everyone is on mute with videos off. Feel free to introduce yourself in the chat box. To enable or disable subtitles, select live transcript at the bottom of the screen. Please use the Q&A box to submit questions for panelists and upvote other attendee questions. We will answer as many questions as we can during the Q&A portion. This event will be recorded. I am excited to introduce the moderator for today's discussion, Dr. Amanda Ramsdell. Amanda Ramsdell, with she, her pronouns, is an addiction medicine and hospital medicine doctor at Weill Cornell Medicine. She is the clinical lead for a housing social work navigation program at Lower Manhattan Hospital. She teaches with health and housing, trauma-informed care, and premature discharges to healthcare workers and trainees. Her efforts include trying to expand access to substance use services and improving transitions for care for patients with unstable housing. Outside of work, she's busy keeping up with her 9-year-old. I will now turn it over to Amanda to introduce our topic and event speakers.
Yeah, thank you so much. And thank you so much to everybody for logging on and being here. Was just reflecting, I've been an attendee at the Flipping the Scripts programs many times and just can't emphasize how valuable and impactful getting the chance to hear people's stories is. So just a huge thanks up front to the panelists for all your generosity being here and just for the time and energy it takes to share your stories. So we'll start by going around and having the panelists introduce themselves and then get into some questions and topics that I think were just going to be really impactful. So we'll start. Ebony McClellan, if you'd like to introduce yourself and give some opening thoughts, that would be great.
Hi everyone. Good morning. My name is Ebony McClellan. My pronouns are she, they, hers. I'm a young youth advocate from Brooklyn, New York. I am also 25 years old. Pivoting into my advocacy world, I was just looking for a home. I prior to AFC, I was unhoused for about 4 years, just really trying to get back on my feet, find stability. And I was introduced to the Ali Forney Center, where I have not only met people who look like me and could respect me as an individual, but I also was able to find different avenues when it does come to just getting back on the right track when it comes to my whole unhoused journey. I was able to find stability and also get connected to healthcare, which was very beneficial alongside my journey. And I'm really excited to talk more about that, about my journey and how healthcare has helped me and how it also just gave me a little bit of insight into why I was afraid to go to those health providers as well. So I'm pretty excited to share my story and really grateful to talk to you all. Thank you so much.
Thank you so much. And I think next we'll go to Jada. Brennan, if you'd like to introduce yourself.
Hi, my name is Jada. I'm 23 and I'm currently homeless in a shelter. During this time, I got introduced to a place called The Door, and they helped me access care. I'm speaking today because I believe no person should struggle with their health care alone, especially someone homeless.
Thank you for that. Definitely. And next we'll go to Majay Louverture, if you'd like to introduce yourself.
Good morning, everyone. My name is Majay Louverture. I am 23 years old. A bit about my story. I actually came to New York just around 3 years ago. I'm originally from Louisiana. I came to the city seeking community, a more affirming environment. And it was in the city that I experienced homelessness for the very first time. In that time, I found the California Center as well. The California Center was very useful in helping me be connected with resources and just being able to build the infrastructure I need to have a stable life, to be able to just live my human life, and sort of alleviated the pressures of homelessness. And yeah, after being at AFC, I was introduced to spaces where not only was I reminded that my voice was valuable, that my voice was important. So I currently serve on the Youth Advisory Board at AFC. And I will say a bit about the main thing that I want to communicate here is just that homelessness is not a character flaw. Homelessness is a circumstance that can find anyone, and it is due to the housing crisis. And it definitely has an effect on your mental and physical health. And yeah, I'm grateful to be here and share my story a bit with you all. Thank you.
Thank you so much. And definitely will, expand on those notes later too. Appreciate it. And next we'll go to Onyx Walker, if you'd like to introduce yourself.
Thanks. Hi, everyone. Onyx Walker, pronouns he, him, his. I was born in Queens, grew up in Brooklyn. Bit of a conflict of interest, I know, but it exists. I was homeless for about 2 years, street homeless. Um, as you can imagine, uh, that would be quite difficult to sort of brave the world out there as a young adult with no assistance to services. But I did it. I survived, and I'm here. For the past 10 or so years, I've been working in organizational work, advocacy work, and youth leadership, ranging from like school to prison pipeline work, justice involved, education reform, and now onto homelessness work. Um, those things are important to me because either I was affected by those things or I know someone who was. And I see it affect too many people day to day. So, yeah, just happy to be here doing the work and looking forward to being able to share my experience with you all.
Thank you so much. So we'll jump in with a question for everyone just to start. And just very broadly, what was it like to try to manage your health, access healthcare while you were also dealing with a lot of housing insecurity and many of the things that you mentioned? What were the challenges? What were you able to access? If you want to just kind of give some thoughts on that, feel free. We can start with anyone who would like to. Oh, Majay.
Hi. So I will say, first, being in this space and even having these conversations, I really was in a position to realize that throughout my homelessness journey, I truly was not in the headspace to consider my health as something that needed to be prioritized and maintained. As opposed to more so, I thought to approach healthcare professionals in the case of an emergency. And as was already mentioned, there is so much work that is like it's your survival. I'm thinking about, okay, where's my next meeting for case management? How many more days do I have in this in the shelter that I'm at now? Where am I going to eat next? And just all of these things that are constantly in my mind that I wasn't really in the headspace to manage to even tend to my healthcare, or to think that was something that I should prioritize. And I would say, like, I guess the biggest challenge was really just slowing down and having that space, which was not something that I was really able to have until I found some sort of stability. Yeah.
Thank you. And Ebony, I saw you had your hand raised too.
Yeah, very similar. My journey, like my main focus was finding stability. And when I was outside street homeless before I got to AFC, I was surrounded by strangers, right? So I was surrounded by strangers and people who I could tell that they sensed like something was wrong, but the people I was surrounded around was mostly people who kind of judged me. And those people who judged me did not know my story, but just just being like called the cops on or like have people like tell me that I could do better for myself. It didn't like really push me to want to do better because the main thing was trying to find stability, housing, and also food, a place to shower. So that was not my main um course to focus on. I wasn't even thinking about the doctors. And when I thought about the doctors, I kind of was a little bit ashamed because I did not have all my documents that I needed. So that was something I kind of put on the back burner until I was able to find that stability and make those next steps.
Thank you. Thank you both for sharing that. I think you really well kind of describe a lot of those barriers, whether it's, I think I saw in the comments, just being in survival mode, having a lot of competing priorities, kind of like safety, survival, like you mentioned. And I think very relevant to, the healthcare workers here, just having the right documents is like a huge barrier for a lot of people to access care. Um, other thoughts or comments from the panelists? Oh, Jada, go ahead.
So in my personal experience, I found it very challenging because of copays, and that often gets in the way of like paying for food. So I normally prioritize food over health. Um, and oftentimes I have to like take care of my health like DIY on my own, and that's not usually a good idea, especially in a shelter. But what has helped is the door, and they have free access to healthcare for people my age. So thankfully, I feel more comfortable making appointments.
That's great to hear. Were there other resources or other kind of helpful ways to access care?
Beyond that, honestly, no, there wasn't.
I think too, maybe also kind of just to throw in this question, obviously accessing healthcare, is challenging. What impact did you feel like, having housing insecurity or, dealing with these issues, how did that impact your well-being and health?
It finding stability helped me because I felt like I had a foundation. Um, that's all I needed was a place to lay my head. So the next day I could get up and plan, or just to know I'm going somewhere safe. I cannot imagine going to the hospital and getting checked up and then going back out on the street and then maybe getting a cold again or getting a fever again. And then just having like a case manager to communicate with, hey, this is what I've been doing. This is, the steps that I've been taking when it comes to my health versus being out on the street and not having no one to conversate or uh, take you to show you the different steps that you can take.
Yeah, so if I'm hearing correctly, just having people who you trust, who you know, who you can go to and help kind of plan out, is supportive of your health, it sounds like. So other thoughts on this? How things impacted either your mental health or your physical health?
Um,
Oh,
I'm sorry.
oh, go ahead. Oh, Onyx, if you'd like to go. And
Sure. Sorry, Maje. I was gonna say I think you'd be surprised at the things that you forget to do for yourself when you lack consistent sleep. Um, and I think during my time being homeless, I found that a lot of the things that I needed to keep going were often getting pushed to the wayside. Um, I think my challenge when I was homeless wasn't just when to sleep, it was also where and how, right? I think there were always multiple questions about how I was going to be able to sleep. Um, and I think that in itself directly affected my health at the time. But often when you're in survival mode, you're not seeing it, right? You're just sort of pushing yourself to keep going. And so when I did find housing, um, I think I finally got to rest, right? And I think that rest allowed me to take a look at my personal circumstance and consider what have I neglected doing over the past couple years, um, and not even just physically, but also mentally, right? What habits did I like pick up that I didn't realize I picked up that I don't need anymore? Um, and that sort of thing takes years to unpack and unlearn, right? Because survival mode really takes a long time to sort of drop, right? I think we often stay in survival mode once we're in it for a long time because that's all we know how to do. Um, and so I'm finding myself even now, years later, still realizing some of the survival mode habits that I had back then that I still exhibit. And so I think being homeless significantly it impaired my ability to seek help. Um, I think for many reasons, I'm sure some of the folks on this panel will tell you, but I think it's quite discouraging often when you're in a situation like that to go and seek help, not only because of the situation that you're in, but also because the people that are supposed to be equipped to help you, more often than not, don't have a full grasp on your situation, um, and the urgency of it. And so I think it makes folks hesitant to then go and reach out for support. Or it makes us more, what's the word, agitated to make those things happen for us, right? Because this is our daily uh, survival mode, right? So, yeah, in my experience, it deterred me from going to seek health supports because the most important thing to me at the time was housing. Um, so, yeah, years later, I'm still finding that I need to remind myself, go and see a doctor, right? Um, so yeah.
Thank you. So much important, aspects that you brought up with that. I'd like to just like emphasize the sleep too, because I feel like that is oftentimes not recognized in the healthcare space. Obviously, you ask any healthcare professional, like, of course, sleep is so important. But what happens when you aren't able to get consistent sleep? And yeah, what you described is so good for everybody to have kind of in mind too. But thank you for bringing that up and sharing. Majay, um, did you have more to say too? That would be
Um,
great. Yeah.
yes, I actually would like to follow up a bit and expand on some of the aforementioned points. One thing that really impacted me, and I realized this once I was able to be around community, was the sort of hyper independence that I felt like I needed to develop, that developed, and that being homeless in New York, was my very first time ever being homeless. And for a moment, there was this sort of like searching for dependency. But then once I had to realize it really set on in me, like, no, it's just me, or at least it felt like that. Then there became this sort of almost like I don't even want to say it's not necessarily a pride, but I felt like, oh, I need to just figure out the things I need to by myself. And from that, I developed lots of habits as well, which were typically coping. And I was really tending more of my energy towards coping with my situation as opposed to like getting to the root of that issue. And being around community, I find it's a bit more difficult to lie to yourself, I guess, because you have other people that are able to say, hey, or even just to ask you, how are you doing, right? And that's not something that just typically happens. People aren't actually genuinely asking you that in the street. No one knows the things you're going through, but being in the shelter and having people who they understand that people are going through things to just ask me, how are you doing? Or if they notice something, for them to be that mirror and reflect back that to me. I find that was also very empowering, and it wasn't immediate, that transition, for me to feel safe and vulnerable to lean into that, but it definitely assisted. And additionally, with the sleep and the rest, I think that's a really important topic, because even for me, even after I did my intake for the first time and I have walls around me, I still didn't immediately rest. That wasn't like an immediate switch. Now I have this. Now the problem is off, because there's still this mindset of, am I safe? Am I secure here? Like, do I have all my things? Like, am I going to be harmed here? Because this is a big world, and when you're homeless, you're immersed in all of the things happening around you. The idea of security, I feel like there's an entirely different definition of security that becomes apparent to you.
Yeah, and I think I'm hearing too, if I heard correctly, from many of you, that process, even when you do maybe get stable housing, it is a process to kind of feel safe, secure there, to kind of maybe readapt for some coping mechanisms that were used in more of like a survival mode time. But I think that's really important just for people to recognize. And like you mentioned, people really may not, do not totally grasp or understand what their patients or what other people are going through. So appreciate everyone sharing. I think we'll jump into, we have some planned questions for the panelists as well. And then the last half hour or so too, we'll jump to questions from the attendees too, if that sounds good. So I think just going off some of the things that were mentioned too, would love to start with you, Onyx. Wonder if you could expand on how your experiences influence the way that you like view the healthcare system, or the pharmaceutical system, or other systems in our society, that were kind of from the experiences that you went through.
I always smile whenever I'm asked about healthcare, because some people don't like it, but I don't think healthcare should be treated the way that it's treated in this country. I think, as a baseline, before I say anything else, I think healthcare right now is treated as a luxury instead of a necessity. And I think it's a problem for everyone, whether they realize it or not. I think people shouldn't be paying premiums to live their lives, right? Um, I think for me, I come from a Jamaican household, and Jamaicans are notoriously distrusting um, of anyone and anything, especially things that they have to pay large amounts of money for. And so growing up, I already didn't trust many, many, many institutions that required you to pay a bunch of money. Um, Honestly, ambulances were the biggest concern for me. Um, and so I think I've always had a general distrust for the healthcare system. I know I'm not beating the stereotype of Black men don't go to the doctor, but um, it's true to some extent. So I guess there's truth in it. But yeah, I've just had a serious distrust about it, and I think my distrust has led me to neglect my personal health more often than not. And I think as I get older, I'm realizing that as much as I don't trust them, it would be worse to trust myself to leave all aspects of my health in my own hands. I'm not a medical expert, and there are things that could be going on with my body that I have no idea about. And so it's better to get a professional opinion than to go online and go to WebMD and self-diagnose and find out that I have stage 4 cancer, right? So yeah, I think it's better that I do that now as time goes along. I'm thinking even recently, I had a health scare in November, and during which time, um, before I even went to the hospital, before I even considered, I assumed it was a panic attack. And had I not had a friend that I was speaking to who actually goes to see her physician often, um, I would never have gone to the emergency room. I would never have gone. I didn't even want to go to the emergency room. I went to the nearest physician, and then they said, "You need to go to an emergency room, or this is going to be fatal." And so I went. I hated the bill that came afterwards, but had I not gone, I think things would have been a lot worse for me. Um, and so, yeah, I guess I say all in all, what I'm trying to say here is I still have a general distrust for the healthcare industry, but it's absolutely necessary that you speak to a professional to check on your health. And I hope that one day people won't have to pay premiums for basic necessities because there are a lot of people who can't afford those things. And the potential of a bill that comes after a hospital visit or a physician visit is just too much for them to be able to handle, and it will deter them from going. So yeah.
Yeah, I like how you brought up just the fact that the cost itself is a red flag of like, what is a system even based on? Hopefully this is not a radical view in this group, but I feel like healthcare access to housing is just a human right. And we are in just like a very mind-blowing situation in this country where that's not the case. But thank you. Yeah, thank you for bringing that up. Because both the cost and then also just kind of like what goes around with that in terms of what a system is built on. Yeah, just a huge basis for lack of trust. Um, Appreciate that. Um, we can go to maybe we'll jump to Jada. Would love to hear more about your experience. I think specifically as a young woman, what was it like to try to stay well, access healthcare while dealing with housing insecurity?
So it's very overwhelming. Um, Having to take care of that on your own, especially as a young woman. Um, you often get told like, why aren't you on birth control? Why aren't you getting a pap smear? Why aren't you doing this? And it's a lot of things. I feel like doctors don't really like, they kind of expect you to know what it is already, or expect you to know like the long-term side effects of birth control, but not making you feel comfortable or uh, filling you in on, hey, this is why I'm even suggesting this to you. This is why you should be getting a pap smear or checking for cervical cancer. Like, it's just a lot of things that are brand new that normally you're used to your mom going with you and talking to the doctor about what you're going through. So it's really a transition, I would say.
And yeah, it sounds like maybe there was an assumption or by providers that you already knew certain information. Could you tell us a little bit more, like what was, the healthcare workers, like how did they try to communicate or maybe not during that time? And would you have any advice for this group who are a lot of healthcare workers here in terms of trying to do it better?
Um, from my personal experience, I feel like uh it might sound biased, but I feel like some doctors will get annoyed if you're there and you're not even sure why you're there, if that makes sense. Like, you know something's wrong, but you don't specifically know what to ask for or what to say. I feel like doctors kind of rush you, or they try to like hurry up and give you medicine, from my experience, and it makes you feel really isolated, or really like, am I wasting my time? Is it even that serious? Like, should I be here, or should I just go back to trying to do a DIY? And 9 times out of 10, you really need to go to the doctor. Um, it's also hard dealing with HRA and dealing with like, they recently cut my Medicaid off. So it's like, now if I wasn't going to the door, I really wouldn't be taking care of my health.
Yeah, so heard of a number of barriers there, just the providers taking the time, to welcome, making you feel welcome that you should be there. They're happy you're there to get the care that you need. But it sounds like just taking a minute, finding out more, being patient, and kind of taking that space to be able to provide good care is really important. Um, Wanted to also, we'll switch to Ebony, if that's okay. I think this kind of also relates a little bit to what you mentioned about accessing services and Medicaid, but I did want to bring up again, Ebony, um, what you mentioned in the intro of having difficulty accessing care because of, not having the right documentation, or, accessing that. If you don't mind just expanding a little bit more on that, I think it would be, yeah, really valuable.
When it comes to accessing documentation, originally when I left my mom's house, or my parents' house, I was not able to take that with me, right? It was like I had to get what I could and then leave. That wasn't my main thing. That's on my mind was my documents. And honestly, because I did not bring that along, I would have to go get new documents. That takes a while. And I did want to mention that prior to me leaving my mom's house and being on my own, I will go to the doctors with my mom. So my mom will be the one who will be speaking for me. And then like no one, like I'm so used to going to a specific doctor and having my parent there and then going to the doctor myself and not knowing what to say or what I need help with. I know I need a checkup, but I don't know, um kind of similar to what Jada was mentioning. I know I need a checkup, but when they do mention pap smears or cervical cancer, that's not what I immediately go for, but this is something that could be pushed. But I also want to highlight that going into the going into the doctor by myself, they also have my record, my records of stuff. So also them letting me know, hey, I noticed in your record that you haven't got this pap smear since you was 12 years old. And now I'm aware that, hey, I may need this, but prior to that, I was 12 years old and my mom was taking me to the doctors. So um just just not knowing the language or not knowing what I need and not knowing like if what the doctor's suggesting is just something that is immediate that I can take on. Can I wait a while to get this, medication or like pap smear or, so that was a little bit of something that I had to struggle with as well.
Yeah, thank you. I think you both brought up something super important that's really talked about in medicine is that transition from pediatrics to adolescent to adult care. But just to really validate, that's a huge transition in a person's life, from going to the doctor with your parent and then to be in that role to have to interact with the doctor, advocate for yourself. So yeah, thank you both for bringing that up, because I think just really great to stress for people working in the healthcare space. And yeah, try to support patients who are making that transition or going to the doctor for the first time. And I guess too wanted to as well ask a question to Majay, if that's okay. And I know we touched on this a little bit before, but wondering if you would expand upon a few things. How your experiences affected your mental and physical health. And then also, if you don't mind adding a little bit more, what was it like kind of accessing healthcare and discussing some of the things you were going through with housing, et cetera, like with healthcare professionals?
Okay. Um, yeah, so as I mentioned with the neglect, I wasn't really thinking about healthcare, but when it came to the moment where I did need to access healthcare, um, first I want to say I think there was definitely an aspect of shame that impacted my engagement and even the way like I I felt about being in need. One, because one, it's like of course I'm already in need in terms of needing stability and need of housing. So I think and it's crazy. I'm realizing this now. I'm speaking about this. I feel like it was also that layer of like, I need to, something has to be okay. Like, it's okay if this is already falling apart. I don't have this. I don't have the stability I need, the security I need. At least I can figure out whatever else comes, like the little things. I'm okay. I'm young. I'm healthy. And I think telling myself that and feeling like it's not that bad, I always minimized whatever it was that I was going through. Um, Minimize like the effect like fatigue was having on me from just like chronic not sleeping. And also I was performing in this time to like make money. So I wasn't getting much sleep at night. And also just like putting my body through things that I didn't need to for the sake, well, that I felt like I needed to for the sake of securing any piece of stability that I could. Because also even once I was in housing, even once I was in housing, there's this like persistent, since the moment I first became homeless, I had this persistent mindset of like, okay, I have to thrive, not only just survive. I'm like, I have to do everything I can to get ahead in life. I have to do everything I can to secure some type of security for myself. Um, and yeah, I think also with that and the shame I associated with it because of the stigma I know that people associate homelessness with. When it came to the point where I had to I remember one time I had a slight injury from dancing and I wanted to just, home remedy it. I was like, try to ask people to like help me, but they were like, you should probably go to the doctor and see about this. And when I arrived at the doctor, I don't know. I guess I just wanted to maneuver through it as quote unquote normal as possible. I felt like me indicating or even bringing up the fact that I'm currently dealing with this in terms of my housing situation. I just didn't want to be associated with homelessness, quite frankly. I didn't want to be associated with all the things that people attach to homelessness. And I didn't want that to affect in the way the doctors were prescribing me anything or even viewing my situation, even just hearing me out. Because sometimes you can hear that, you can see that switch in people. And I've seen it even without people knowing that about my particular situation, seeing it with how other people are treated who may be more vividly going through it, right? You'll see how other people engage with that. And I being aware of that, I I guess I didn't have faith that that would turn off because now these people work in a hospital. I'm like, because my mindset is just people are people. And if I'm seeing people engaging with people who are experiencing housing insecurity a certain type of way, why would it be any different in a hospital?
Yeah, really speaking just to the stigma that is associated necessarily and being just cognizant of that when you walk in to the hospital. Um, Wanted to also just follow up with that and ask what would need to happen, to create more of a comfortable or safer space to share a little bit about, some of those competing priorities, housing issues with your, that the healthcare professionals who you're working with. What do you think it would take to create more of a comfortable place to talk about it?
My first thought when I hear that question is honestly outreach. Um, And I say that to kind of support what Jada was saying about the door and having these resource centers for us. I think those spaces are designed and geared towards being welcoming for us. And one, they're often, a lot of times they offer wraparound services. So we're getting many of our needs met there in this place. And that helps us because even though you may be in a shelter, there's still a constant journey of finding stability. Um, like you're constantly thinking about how long do I have here? What is the next step? So I think having more healthcare professionals come out to these spaces. And even if it's just like, I've seen like you all for like job fairs or something like that, but even if it's just like for like hold a seminar, hold a Q&A for people, like being engaging with the community, directly with the community, because what we tend to congregate with each other because we know that we can get the needs, our needs will be met more in certain organizations, in certain spaces. So if I were to see, for example, NYU Health at the door at Streetworks, I'm going to be more obliged to want to come there. And when I see this space in the world, like out in the city, that indicates to me that, oh, this is a safe space for me. I should be able to go here because I know that they're actively engaged. They're showing me that they're engaged. They're showing me that they're here for us, and that you have to show up for that, I think. And yeah, and even in terms of in the hospital, I will also say accessibility needs, even asking that. I know when people are there, you're usually thinking about like their most immediate health needs, but where is the space? And I think introducing a space where people can name the things that they're going through outside of what they feel like may be a direct health issue, then maybe they could also give the doctors more insight for things that they should consider. Because again, we don't always know that because we're experiencing something right now, like that this is impacting us mentally or this is impacting us physically. And I think that's where the healthcare professionals can make more informed and take more informed insight on that. But that won't happen unless we have that space too. So outreach and introducing accessibility needs, asking about accessibility when people are in the spaces. Because homelessness doesn't have a certain look. So I think that's a really important thing.
Yeah, thank you so much. Such an important topic too. I know I shared like just a little bit when we were planning for this session, but definitely wanted to take some time to talk about that because as many people might know, there's a huge push for hospitals to ask about housing status and other social determinants of health. And even, for a time was like a requirement. But I think we all need to pause and or emphasize, I should say, making sure it's asked in a very thoughtful way, where patients have support after they share. So really appreciate that. And I think if the other panelists want or have thoughts on this too, if you've felt comfortable or not talking about housing status within the hospital or the healthcare space, definitely wanted to open it up too, because I do think this is such an important topic. Oh, Ebony.
I wanted to add that I was not asked about like my housing status until I got to AFC and they like connected me to like a hospital or a doctor that was able to understand me and who catered to people in my community. And prior to me going to AFC, I wasn't connected to a doctor, so I was not asked those questions, but I did want to share a recent moment where I did go to the hospital with somebody else that needed to get checked in, and I did see someone that was unhoused that needed treatment. Like he seemed like he just got into an accident, and he needed to rest. He really wanted to rest, but the doctors kind of was trying to rush him out and usher him out. So I kind of really wanted to make that connection with Maje, what they said, like actually taking time to see one's accessibility needs and see if there's any way that they can get even trust that person or have that person trust them to help them find stability or help them even motivate them to go to a shelter or even like hearing them out on why they may not be in a shelter right now, what led them to being unhoused, and it's just connecting them to the resources that they may need.
Yeah. So like you said before, taking that time, having maybe a little bit more patience than is typical in the healthcare setting. And I think really important though, too, like having some way to connect to useful resources for that person if they're interested and there's a way to connect. Really important. Um, Jada and Onyx, any other thoughts on that? We have a few questions from the Q&A, but would love to hear your thoughts before we move on.
As far as adding on to what Majay said, like having outreach centers, I feel like is one of the most important things for supporting us because, like how you asked earlier, like, was there anybody else or anything else that supported you outside of the door? My answer is honestly no. Like having those centers, it is a safe space for you. It makes you feel like, okay, at least they understand what I'm going through. But I also wanted to add on to what Onyx said, like healthcare shouldn't be like a luxury. It shouldn't be like even the fact that you have to pay for pads and you don't get them for free, or from my personal experience, you don't really have access to that much water. Like in the shelter, they give you like sometimes one water bottle for breakfast. They don't give you any water. So I feel like a lot of things are treated like a luxury and they really shouldn't be.
Definitely cannot emphasize that enough for sure. Thank you.
I guess I'll add as well. I think I have a lot of thoughts. First thing, as Jada just mentioned about the luxury of certain things, I mentioned the ambulance ride because it's sad, but it's comical to me that the price of an ambulance ride is higher than the cost to rent a limousine. And that's amazing to me because there's no way that you're charging someone thousands of dollars in their moment of need to be transported to an institution, probably not of their choice, right? Um, and then when you get there, I think there are, again, to Jada's point, there are folks who, again, in crisis, they might not have eaten, they might be dehydrated, and they need some food. But what do you hear when you're at a hospital? Not to eat any outside food, right? You are supposed to eat whatever is present if they even allow you to eat. And then there's the fear of paying for that, right? That appearing on your medical bill. Now, I haven't examined any of my medical bills, but if I ever see hundreds of dollars for hospital food, I'm going to lose it because again, I think that it's too expensive to do just general things when and again, this is when you get to a hospital, right? I also think what we haven't touched on as much is as a young person, I think exploring healthcare is tricky because there is so much that you are learning about the world, but there's so much that you don't know about healthcare, right? The first time I heard about a copay, I was 23, right? I didn't even know what that meant before then, right? And then finding out that you need insurance if you don't want to pay an arm and a leg, and then finding out that when you do taxes at the end of the year, if you don't have health insurance, you get penalized again. I think again, there are just too many premiums and price tags on healthcare and survival, just period across the board. Um, I think Majay touched on something that I'm glad that they touched on, and it was about stigma. I think there's so much stigma to unpack, unfold, and understand because not only is there the stigma that comes with people identifying you as someone who is or have been homeless, but then there is also the stigma of what happens when you're reaching out for mental health care or healthcare, depending on your gender expression or anything related to that, right? I think there are just too many stigmas to unpack. And I think if you check all of these boxes, I think it leads people to often disregard what you're saying to them, right? Um, and I think that it's extremely discouraging, right? Because there are people who are adamant enough about their healthcare to say, okay, this is exactly what I need, and no matter what you tell me, I need this to be done. But then there are people who lack the self-assuredness and confidence to assert their needs, right? And so they just do whatever the doctor says or the nurse or physician says, and they're like, yeah, you're fine. They're like, okay, well, I guess if the doctor says I'm fine, I'm fine. And then they go home and then the problem persists and then they have to show up again for another bill. And it's just too much. It's just too much. And I think that that can then lead to other mental health issues, right? And I think there's a lot of work to be done in order to build trust in the healthcare system. But I think, again, that starts with a baseline of changing it from a premium price to a necessity. Um, I can't stress that enough. In my experience being homeless, again, I didn't visit any doctors, any dentists during my entire time being homeless. Didn't do it once. Um, and didn't understand the significance of dental health until later, right? Um, and again, dental health, it might lead to a lot of different things that you had never thought possible, right? What goes on in your mouth could definitely deeply affect what's going on uh, inside the rest of your body. Um, and so, yeah. So I think I'll close this by saying I think it's important to consider how young people who might be at a disadvantage interact with the healthcare system. I think there's so much to learn about the world as it is, but if the healthcare system it's expensive and it's a maze to navigate, what hope do young people truly have to be able to get quality access to healthcare?
Thank you so much, yeah, for all of that. I think, again, yeah, it's worth bringing up again and again. The cost is just unacceptable to stay well. And I think too, I don't know if this lands with you, but just kind of throwing it out there, kind of like naming it, is that like power differential in the hospital that we talk about a lot, where it's very vulnerable to go in as a patient no matter what's going on. And there are those kind of like hierarchies. And do I want to question the doctor? Do I want to maybe say this doesn't seem right? Or takes a lot to kind of, for anyone to advocate for yourself. And when you're dealing with so much else, that's really, really challenging. But thank you for bringing that up. I do want to go that we have a few questions from the Q&A that would love to bring up here. The first one touches on what many of you mentioned before of just that kind of that process of getting stable housing and just, kind of getting out of some of the coping mechanisms or survival mode. And so the question is about what service providers or people who are running permanent housing programs, like how can they help young people who are transitioning into housing? Or are there things that they shouldn't do? Onyx?
I'll take a stab at it. Um, I think there are a few things that I think at a baseline should be present before we get to that place of helping young people transition into understanding healthcare and that sort of thing. I think having peers on your team, I think, is a necessity for bridging that gap. Um, People who understand it and have been through it, I think, will be indispensable in helping those who are currently affected be able to navigate that. I think it makes the process a bit more manageable and understandable. And I think the weight of it might be communicated a little bit better. I think then after that is present, I think it would be helpful to sort of have a crash course, right? I think a lot of service providers and supportive teams are incorporating mental health supports within them, which is amazing, right? But I also think that there should be healthcare navigators as well. Um, Even if they're not a part of the team, I think it would be helpful to have someone connect them to those services as all of that's going on. It's a super chaotic time, and I think with the whirlwind of, okay, I have a new place. How do I manage this lease? How do I take care of myself in this new place? What are my rights as a tenant? And how do I get out of the survival mindset? I think there's just so much that comes with that. And I think it'll be super helpful if there's actually a dedicated role to helping someone navigate that sort of thing. I think if folks can't afford to create that sort of role, I think the next best thing, in my opinion, for them to be able to do that would be for them to have it built into their wraparound services, to directly address it at the outset, right? Young people are coming into your program looking for housing. I think as they're being onboarded or accepted into this program or whatever the case may be, I think it should be mentioned upfront. We want to make sure that you understand and have access to healthcare. Even if we can't provide that for you, we want to help you understand how to get that, and we want to guide you through that process. So that way it's not tacked on at the end. Um, and then it's sort of just left in their hands to figure out. I think it should be mentioned at the outset and worked on until they're transitioned out.
Yeah, that is great to know. And I think kind of connecting to what Jada, you mentioned, like somebody to make sure your health, their insurance is active and kind of navigating, troubleshooting there. Wonderful. Yeah, wonderful ideas. Other thoughts about what would be helpful, Majay?
I don't think I can say it better than Onyx, but I truly agree. I think being able to education is always like the best prevention, and it's easier to prevent than it is to heal something. And I feel like when you're in a vulnerable situation, the people that you engage with, the organizations you engage with, they have the potential to either widen a gap sternly or bridge a gap sternly, because it's like you're either gonna cling to something or you're gonna like because you're already going through things, at least in my experience, it was like this. It's like I'm definitely not associating with this because they rubbed me the wrong way in this aspect, right? And I think also important recognizing that the ripple effects that you have on that people, I don't know, opinions have on others, so even just having someone who is leading a housing program, for example, to be able to make that impression, like we're already in a position where it's a good space to receive you, if you come in the right light, right, and you come with that intention. And being I think it's a really important aspect of the rehabilitation that comes along with gaining housing and stability, right? Because it's also, like I said, it's not just you now have these four walls around you and boom, okay, now where I'm secure, I'm back on my healthcare regimen, I'm back on my career regimen, my spiritual regimen. That doesn't just immediately happen. I think it's a really important also reminder that like, hey, this is a part of being a whole human being. This is something that you should value. This is something that, of course, you're going to need to know how to navigate. So there definitely should be information distributed upfront and initially as we're integrating into these systems, just as that to serve as that reminder and those sort of building blocks. Those healthcare as a building block to like being a stable, full, well-rounded human being, and I think it should be introduced and treated as such. Yeah.
Thank you. Other thoughts up in here, Jada, on that question?
To add on to Majay and Onyx, I do agree. Education is really the biggest prevention because a lot of young people, the same way they don't know about copays, they don't know about rent, about taxes, about a lot of the transitional part from a shelter into having your own apartment and having community or having people who are educated supporting you makes it a little less stressful because I feel like a lot of people don't know how mentally draining or mentally harmful it is having to hear, oh, is your HRA filled yet? Did you do this yet? Did you do that yet? And then it's like so much thrown at you at once, and then you still don't get any um, feedback on, hey, how's the voucher going? How's this going? It's like really, really isolating. So I would definitely say community and education.
Thanks. Ebony, any thoughts?
I would say when someone is initially going into the shelter, to like, I guess, really tap into that person and ask them where are they in their health journey, or if there's any immediate hiccups or immediate care that they need right away, and amplifying that throughout their transition through the shelter into home, into their own housing, and also aftercare, follow up on them, and just making sure that they're okay.
Thank you for that. We have another question too that in my mind is a little bit related. And it has to do with gaining trust with service providers. I know we were talking more about permanent housing or supportive housing programs, but wanted to put that out there, like what helped build or gain trust with service providers. And yeah, did that help kind of get to the next steps for receiving care? Oh, go ahead, Ebony.
I would say that going to AFC and connecting to a healthcare provider that was already familiar with the majority of the clients going coming from AFC, being asked the right pronouns and just respecting my gender overall, that was that was how you get me to open up, or just like that respect and just knowing me individually and understanding my predicament as well from these healthcare providers. They will ask me, am I housed? Or like they will ask me questions about my mental health. So to be connected with somebody who can meet me where I'm at or understand the situation that I'm in helped me to open up more and to like share parts of my story as well.
Thank you for that. Other thoughts?
I would like to say that um, I feel like being consistent, like making sure that your reputation can show, like, hey, we're trustworthy, or um, kind of stuff like this. Like, if I know that you are a doctor that was in this call, but then also, let's say, they went to another outreach center, I'm gonna feel like that's consistent, or like you're consistently showing that you're an ally for homeless people and that you can be trusted.
Great point. Najee?
I definitely want to agree and uplift what Ebony and Jada just said, and also just at the aspect of listening. I think really listening before you make decisions, and also to asking asking the important questions. And as we're speaking on stigmas, I think it's important to know that other people can see when you're stigmatizing them as well, even if it's not something that you're immediately saying, even if it's in the way you probably asked me a question. Then after that question, you don't feel like you have to ask me anything else. We're also aware that, oh, that's just what happened. Now you placed me into a box that you feel like you understand because you're told that, because we were made to believe that people that fit into this demographic, or they deal with this, they're more prone to this, da 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 da. But at the end of the day, I think recognizing that you're engaging with an individual human being. And I always say one of the biggest issues, not just with like healthcare professionals, but just in the world in general, is everyone knows everything, you know? And when you lead, I think leading with curiosity and like genuine curiosity and wanting to understand, at least for me personally, I feel more obliged to open up and actually share my story, because I am aware that like you actually want to know and you're not just trying to get me to put myself into a box that's easier for you to categorize. Because there's a difference between asking someone a question and asking them which box do they fit in.
Thank you so much. Great reminder too to all the healthcare professionals here. It's like a constant necessary process to reflect. Like everybody has some degree of bias within them that they're not aware of, and just to kind of like keep checking that kind of like throughout the day, throughout their careers. But really important points you bring up. I think we'll move on to just the next question too. Somebody in the audience was wondering if you all had any experience with healthcare providers who provided services either within a shelter system or were part of the street outreach medical teams, and what your experience was like with those programs and providers, and was it helpful? And if not, what could have been more helpful about them?
Um, I it's so crazy. The only, I guess, health provider that they didn't do like outreach, but I felt safe to go to was the door. And they did have like dentists down there, they had the doctors down there, and it was like a big space where, like when you go down there, there's chairs, it's arranged like a doctor office. So, and then like on top you have like different like areas you can have lunch there. You have like a clothing closet, you can meet with your case manager. So for me, having that all wrapped around, it just felt like a safe space. I can go down to talk to my doctor and get a checkup, and then if I needed to, step up and get something else like lunch or something like that. But I can envision more outreach in that way, where housing providers uh, set up like set up outside or come to drop-in centers and talk to clients.
Thank you. And yeah, just great shout outs to the door too. I now have like a great view of them after this conversation. So appreciate that. Other thoughts or other experiences with like, different programs of medical providers kind of meeting people where they are.
I was adding on to what Ebony said. I was going to say the door. I know that keeps getting talked about a lot, but I will say outside of that, shelters could be better at providing healthcare because I don't know how every shelter works, but mine, I haven't heard anything about like any connections to healthcare. Um, they don't give pads. They don't like I'm pretty sure if I was to have the flu right now and I went downstairs, they would look at me like, what do you want us to do about it? So I feel like um, shelters should be more like the door or more having that included because those go hand in hand, being homeless and your healthcare.
Maje or Onyx? Oh, Maje.
Um, yeah, so I actually one of the organizations I went to besides the door, well, healthcare providers, I was actually connected to. It was I guess they had a partnership with the California Center. I'm not sure if it was exactly a partnership, but like when I would go, it was the Family Health, I think in Harlem. I'm not sure if that's the name of the hospital. I just know that was on the door. Um, but yeah, when I was there, there was someone from AFC who was there, like in the front, just like as like a person to like welcome us in. And um, yeah, I don't know. I think also too like the outreach, and I really can't like stress the importance of outreach and collaboration enough because being with at the California Center, though, with considering this is an organization that took me in when I was at my most vulnerable, and they have been providing me the things I need, I'm going to have trust and rapport with them because they have shown me that they are consistent and they are invested in my growth. And so I think having partnerships, whatever healthcare organization was in partnership with them, I was going to feel obliged to go there anyway. And I think also to just I don't know, just that association, that even the thought that I don't know who made the effort to have that partnership, whether it was the hospital or Ali Forney Center, but in the case that it was the hospital, like, oh, you care about our people. You're showing with your actions that you're an ally, you know? I think knowing that something is not performative, really makes it easier to like just be human, be real with the people that you're engaging with because it is very apparent that that care is and genuine.
Yes, you bring up such a good point, just like that connection. Sometimes it's way harder than it needs to be, that connection between programs and the hospital system and vice versa. Onyx, any thoughts on this question?
I don't have too many thoughts. I actually, when I was street homeless, I didn't receive many services. My experience was very different than a lot of the folks that I've worked with and come across. Um, I think it could be that the system hadn't evolved at that time to where it is now. But I did seek services a few times, and I sort of was given the runaround. To be clear, I think often this happens with homeless folks. You need one document in order to get the next, in order to get the next, in order to get the next. And at the time, I didn't have any of those things. And so being able to receive support was always a multitude of hurdles just to even get my foot in the door. So it sort of just discouraged me from seeking services. I think the first place I went was the door, actually. And this was back in, uh, what year was this? 2017. Um, So yeah, I mean, I think a better way maybe to engage folks who are experiencing street homelessness. I think one is to check the barriers for support and barriers for entry, just at a base level. What is absolutely needed in order to help these people, and then I think we touched on stigma earlier. Thank you again, Majid, for mentioning that. I think one way to challenge and break down some of those stigmas in some of those street homeless people, because often there is a large, deep seated trust or distrust of systems. I think folks should think creatively about different ways to engage them that isn't so head on about the issue. I think there are many different ways to engage them with whether that be community events or other incentives that are slightly related to this, right? Um, I was able to survive due to having a support system that loved and cared for me, not because of the RHY system, um, or because of the mental health system or physical health. My support system was strong enough to be able to support me in my time of need. And a lot of people are not as fortunate enough to have that. So I think it's important to find other ways to engage people without directly addressing their issue, because you know what you're there for. You're there to help these people, and it will come, but they need to be willing to accept this help. And so you have to find ways to engage them as well. And so I don't want that to go understated, because some of these people need help but don't realize that they do, or are unwilling to meet you where you're at, because you need to meet them where they're at. So yeah.
Yeah, thank you for that. Great pieces of advice. Majid?
Yes, I just want to add one more thing because Onyx, I really appreciate what you touched on. I think another important aspect of this to remember is there are definitely tiers to homelessness. And even experiencing homelessness, which is not easy, I personally feel like I was privileged to have been able to be within the RHY system, right? Because there is that infrastructure that exists for us that makes these connections a bit easier, even just in terms of like the stability. But a lot of people, there are people who are youth who are not in the RHY system for whatever reason. There's can be safety concerns that say there aren't many options, for example, for queer young people to have safe spaces. So let's say for whatever reason you're not allowed at one shelter. Now the other shelters you're probably not going to feel safe at. So now you have youth who are street homeless, right? And I think with engage. I think it's important to consider that when in terms of engaging that yes, you can, there's outreach that you can do with partnership with these organizations that serve the youth, but there is also going to be a percentage of the population that is missed if you're not also creating events and spaces for people who don't have access to those services. Yeah, I just wanted to add that.
And there was actually a question that came in related to that of any recommendations. How do you reach people who might not be connected with those programs or services?
Community events. I almost broke my fingers trying to answer this. Um, Community events are so important. I think they were responsible for my introduction into advocacy. When I think about advocacy and when I started it 12, 13 years ago, probably more than that by now, it was because of a community event. There was something happening that I was interested in that wasn't directly advocacy focused. It was hosted by the advocacy organization, and that was super key in order to even get me in the room. Right. And then once I'm in the room, now they can give me their spiel. Wow, you got such a great voice. You know how to speak and all that. Right. So like I think that sort of thing is super, super helpful to engage people who might not otherwise be seeking these things. Just put the opportunity in their lap in that way. Um, I think even with the work that I do, I think folks are often looking for that sort of thing, and there's a hunger for regular social engagement outside of the work that we're doing on a day-to-day basis, right? And so, community events super key. Do them if you can. Find room in your budget, make it happen. Invite all the people that are in the sector, outside of the sector. Just trust me, it will make a difference.
And if you don't mind me asking, what makes a community event successful in your mind, or what was that thing that, kind of brought you to be interested?
Yeah, when I was younger, food and money was enough. Um, So if you say there's free food, I'll be there. Now it's going to take a bit more for me to go to a community event. But even with the work that I do currently, I work with a group of lived experts, the New York City Youth Action Board. Um, and we did a fashion show in November. And that was super pivotal because it engaged a lot of people who sort of just needed a bit more positivity. In their day-to-day work. It was successful because it again it brought that positivity, but it shifted the lens a little bit on what homelessness means, right? And I think um, because we work in a social field, it's very easy to sort of sink into the dreary, gloomy talk, right? Because it's sad, right? Um, and it's an inevitability that these sort of things that we're talking about, people are suffering under. But I think it's also important to have those community events because it gives you an opportunity to shift the lens and uplift folks. Um, and so I think if you want your community event to be successful, make sure you have food, make sure you make the guest list as long as possible, speak to people directly, um, activate young people at every level, whether it's outreach, putting the event together, or the day of, because young people really care about this sort of thing as well. And make sure you get the big important people to show up too, because we don't see them in a lot of these spaces. And seeing those people in these spaces will be more encouraging for folks to actually believe in the system.
Great, thank you. Other thoughts, Majay?
Um, I just have to follow up on what Onyx said because the thing really definitely beat me to it. I just want to expand and say on even like the food, I think it's really important to recognize that meeting people where their material needs are directly first is vital because at the end of the day, to when people are navigating the world in survival mode, your immediate thought is like, okay, what is the next thing that's going to secure? How is this securing me something? How is this like, what is this doing for me? So I think having that first and also showing that support, showing that you are aware that yes, you are in need of these things, but also to organizing the event in a way that it is like empowering. I feel like it's something that is important because like people want to do better, people want to feel good about themselves, right? But also to one aspect of like a mental health aspect that comes along with homelessness is like it's not always easy to have courage to even want to do certain things, right? It's easy to get comfortable and like I'm just going to go to this resource center because I know I'm going to get these things I need. But to sort of bridge that gap, I think it's important. One again that it's organized with as many youth leaders as you possibly can because like again, especially if you want to like address issues within the youth population, youth homeless population, we listen to each other, right? We value each other's opinions. We already have rapport with each other. Yeah, I think that's really important. Addressing the material needs and also working with the people that have already established rapport, because those things aren't something that's going to be easily acquired, right? You can't just maybe post something, people are going to be like, oh yeah, I can trust them. I should go to them. I know that that's going to be a welcoming space for me. Utilizing the leaders who are already in action and already pushing this work. Like to encourage people and to even give people the space to be aware that they are a full human being and they deserve to have this and they deserve to have that. Working with those people, I think is really important also to have a successful event and to yeah, to efficiently like do outreach with the communities that we're speaking about.
And I imagine too, like you said, just taking the time to learn who those trusted people are, instead of maybe jumping in to planning something. But really appreciate that. Um, Jada or Ebony, thoughts on this question?
I think that they said it all, just having young people engaged, making a list of providers to come to represent us, to speak on our behalf, meeting people where they're at with food, prizes, clothes. Um, and an example of this, I don't know where, but I saw a TikTok and they did a block party for the homeless, for the unhoused people, and they just had a blast. And I just saw them, dancing, being able to eat, interacting with people on the street, being part of the community. So really supporting people and treating everyone human. I think that would be the best case.
Very, very well put. Just I think of anything from this, just treating people with respect in their humanity. Just a huge, huge takeaway. Um, Jada, other thoughts?
Um, Everyone pretty much hit the nail on it. Um, just catering to our needs first. Like everyone else said, having free food, having water. I feel like that's an important one that gets overlooked. Clothes, just making sure that, like I said earlier, you're being consistent in your actions and you're showing like Majay said, making sure you're not being performative, but hey, like we actually are an ally.
Thank you. And I know we only have a few minutes, about 5 minutes left. So just wanted to take some time in this last part. If there's just anything that the panelists didn't get a chance to mention, just to leave the group with, leave everybody who's attending with. What would your kind of final thoughts be, actions that people can take away from this as healthcare workers, or I would say just as people, doesn't have to be, in their healthcare roles, but just hearing this, I think many people are going to be inspired, taking your stories with them really to heart. So just wanted to give everybody a chance to say a few final words. Onyx?
Um, yeah, well, I just want to say I'm glad that so many people came. A lot more people than I expected. So that clearly means that there are a lot of folks out there that are interested um, in shifting the needle towards something that is more positive and impactful. My advice, if you're willing to take it, is I think as you continue to approach the work, think about the barriers that exist to accomplishing those goals. I think barriers serve a purpose, but I think when you're looking to help people, you should try to lower them as much as possible. And I think there are a lot of people who will never know what you're talking about unless you yell it. And that's like a figure of speech for me saying promote it more. Um, I think there are lots of stigmas to undo. There's lots of access to shift. There are lots of costs to being able to maintain your health. And there are lots of challenges to finding housing. And I think with all of those difficulties, it's more important now than ever to make sure that we are doing the best that we can to lower barriers for folks to receive support. Um, Again, Maji touched on this, but reimagine what homelessness looks like because it doesn't look the way that you think it does. Um, there are so many homeless people in New York and across the country, but especially in New York, and you would never know just by looking at them. Um, so really challenge yourself to redefine what that looks like, and you will learn a lot more about how to navigate working with affected populations than you otherwise thought possible.
Thank you. Maje?
Mhm. Um, I guess a few things I will say. One, on checking bias again. I know it was aforementioned, but like I think recognizing homelessness as a circumstance, and moving with that empathy of understanding that circumstances can find anyone. I feel like it's very vital and important for even just leaning into the sensitivity that is needed to address the needs of homeless population. And also too, there is so much power in this work, I think, and recognizing that I'm pretty sure you're all invested in this, you're healthcare professionals here in this space and even just join this call, but just knowing that you never know how impactful the way you engage with someone can be. My mother always tells me, like, you never know what someone is going through. You either can push them over the edge or stop them from jumping, you know? And I don't know, I think I would just like to leave you with that and just think about how within these spaces and regardless of the circumstances someone is going through, how can you utilize your humanity and the position that you've been in with the expertise you have? How can you use that to actually intervene and into someone's who is in need's life, you know? And like Onyx said, that doesn't always look the way you're imagining it, but looks can be deceiving and the need is still there, you know? Yeah, that's all.
Thank you. Jada?
Um, First, before I say my advice, I'm very grateful for everybody that showed up today. And it does make me feel a lot safer knowing, okay, maybe doctors really do care. They really do want to know our experience. So it makes me feel like everybody's moving in the right step in the healthcare community. But the advice that I would leave for doctors is simply be a lot more patient and understand that just because somebody's a young adult, they might not know about a lot of medical terms or medical things like copays or pap smears, like a lot of things that most young people had their parents speaking up for them about. Try to be a little more patient and really inform young adults about these things.
Thank you. And Ebony, we'll finish with your thoughts.
I would just add, also very thankful for everyone who showed up today to hear our stories. I think that showing up to more panels like this and doing outside research can go a long way. And I think that being in this panel is a first step into learning more about unhoused people and their connection to healthcare. So I'm really happy and also feeling really safe to even interact with with the doctors more often.
Well, just wanted to say huge thanks to all the panelists for this amazing discussion. I just know that this whole group, everybody who attended, got so much out of this, and I hope they take it forward into their day and just share it with colleagues. Like you said, keep learning, but really huge thank you for being here and sharing so much of yourselves and your stories.
Thank you, Dr. Ramsdell. I wanted to say thank you to the speakers and our moderator for participating and for the attendees for joining us. Have a great evening, and we look forward to seeing you at the next Flip in the Script. Bye-bye.